Hello everyone, welcome to my another video. Today we discuss about most important MCQ for upcoming NORCET 2023. This is part 9. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 81. A client is admitted to the drug detoxification unit for cocaine withdrawal. What is the nurse's primary concern while working with clients withdrawing from cocaine? Option A, risk for self-injury. B, potential for seizure. C, danger of dehydration. D, probability of injuring others. Right answer is option A, risk for self-injury. The greatest risk in cocaine withdrawal is risk for self-injury. The risk for seizure is increased while under the influence of cocaine, not during withdrawal. Although dehydration can occur during cocaine use and withdrawal, it is not the priority concern. People in cocaine withdrawal, although irritable, hurt themselves than others. Next question. A client is admitted to the psychiatric hospital after many self-inflicted non-lethal injuries over the last month. Which level of suicidal behavior is reflective of the client's behavior? Option A, threats. B, gestures. C, attempts. D, ideations. Right answer is option B, gestures. Suicidal gestures involve superficial, non-lethal injuries. The client has no intent to die as a result of the injuries. Suicidal threats are a person's verbal statement of intent to commit suicide. There are threats but no action. Suicidal attempts are actual implementations of severe self-injurious acts. There is an attempt to cause serious self-harm or death. Suicidal ideations are a person's thoughts regarding suicide. There is no definitive intent or action expressed. Next question. Which activity is most appropriate for a nurse to introduce to a depressed client during the early part of hospitalization? Option A, board game. B, project involving drawing. C, small aerobic exercise group. D, card game with 3 other clients. Right answer is option B, project involving drawing. An art type project that may be worked on successfully at one's own pace is appropriate for a depressed client. Board game and card game with 3 other clients requires too much concentration and may increase the client's feelings of despair. This client is probably experiencing psychomotor retardation, and at this time, a small aerobic exercise activity would not be appropriate. Next question. What characteristic of anxiety is associated with a diagnosis of conversion disorder? Option A, free floating. B, relieved by the symptom. C, consciously felt by the client. D. Projected onto the environment. Right answer is option B. Relieved by the symptom. The client's anxiety results from being unable to choose psychologically between two conflicting actions. The conversion to a physical disability removes the choice and therefore reduces the anxiety. The anxiety is not free-floating or diffuse, but rather localized and converted to a physical disability. The conversion of the anxiety to a physical disability occurs on an unconscious level. The original anxiety no longer exists, and the client generally is not anxious about the physical disability. The anxiety is internalized into a physical symptom, not projected onto the environment. Next question. What is an appropriate way a nurse can help a client to decrease anxiety? Option A. Avoid unpleasant events. B. Prolonged exposure to fearful situations. C. Acquire skills with which to face stressful events. D. Introduce an element of pleasure into fearful situations. Right answer is option C. Acquire skills with which to face stressful events. Learning a variety of coping mechanisms helps reduce anxiety in stressful situations. A person must learn to cope with unpleasant events that cannot be avoided. Prolonged exposure may increase anxiety to possibly uncontrollable levels. Fearful situations can never be viewed as pleasurable. Next question. A client is scheduled for ligation of hemorrhoids. Which diet does the nurse expect to be ordered in preparation for this surgery? Option A. Bland. B. Clear fluid. C. High protein. D. Low residue. Right answer is option D. Low residue. A low residue diet limits stool formation. Blend diets usually are employed in the management of upper, not lower GI disturbances. Although a clear diet is low in residue, but it does not meet nutritional needs. And a high protein diet is indicated post-operatively to promote healing. Next question. A nurse is assessing a client with a diagnosis of diabetes insipidus. For which signs indicative of diabetes insipidus should the nurse assess the client? Option A. Increased blood glucose. B. Increased blood pressure. C. Decreased serum osmolarity. D. Decreased urine specific gravity. Right answer is option D. Decreased urine specific gravity. Because water is not being reabsorbed, so urine is dilute, resulting in a low specific gravity less than 1.005. Diabetes insipidus is not a disorder of glucose metabolism. Blood glucose levels are not affected. Loss of fluid may decrease the blood pressure because fluid is lost from the intravascular compartment. As fluid is lost from intravascular compartment, serum osmolarity increases not decreases. Next question. For which clinical manifestation should the nurse assess a client with metastatic melanoma? Option A, oily skin, B, Nikolsky sign, C, lymphadenopathy, D, erythema of the palms. Right answer is option C, lymphadenopathy. Lymphadenopathy occurs in clients with malignancies that have metastasized. The skin generally is dry and itchy. Nikolsky sign, that is external layer of the skin, becomes detached from the basal layer when rubbed by slight friction. It occurs in clients with pemphigus, not melanoma. Erythema of the palms is not symptom of melanoma. Next question. A client experiences a traumatic brain injury. Which finding identified by the nurse indicates damage to the upper motor neurons? Option A, absent reflexes, B, flaccid muscles, C, Trousseau sign, D, Babinski response. Right answer is option D, Babinski response. A Babinski response, that is dorsiflexion of the first toe and fanning of the other toes, is a reaction to stroking the lateral sole of the foot with a blunt object. It is indicative of damage to the corticospinal tract when seen in adults. Hyperflexia is associated with upper motor neuron damage, not absent reflexes. Increased muscle tone spasticity is associated with upper motor neuron damage. Trousseau sign is indicative of hypocalcemia. Next question. What should the nurse instruct the client to do to limit triggering the pain associated with trigeminal neuralgia? Option A, drink iced liquids, B, avoid oral hygiene, C, apply warm compress, D, chew on the unaffected side. Right answer is option D, chew on the unaffected side. The client may be able to avoid stimulating the involved trigeminal nerve and thus prevent pain by chewing on the unaffected side. Food and fluids that are too hot or too cold can precipitate pain. Although oral hygiene may initiate pain, it cannot be avoided. It can be modified to include rinsing the mouth or using a soft swab instead of a toothbrush, and warm compress may precipitate the pain. So this is the today's video. Thank you so much for watching my video.